Today, let's look at what neonatal jaundice is. Neonatal jaundice is a medical condition that occurs in babies less than 28 days of age as a result of accumulation of unconjugated bilirubin in the baby system, and it's usually characterized by the coloration, the yellowish coloration of two main observable places, the skin and the parts of the eye we call the sclera. There are two forms of neonatal jaundice I want us to take note of. We have the physiological jaundice, which is usually normal and happens until after, or does not occur until after 2 to 3 days after delivery, and happens as a result of the immature liver of the newborn to get rid of this bilirubin from the system. So it's usually normal, physiological. And pathological jaundice, which occurs the first or during the first day of life of the baby and may persist for more than 2 weeks, and usually is due to an underlying conditions. We'll come to some of these conditions. So pathological jaundice, which occurs during the first day of life of the baby, and then physiological jaundice, which do not occur until after 24 hours to 48 hours, after 48 hours to 72 hours of delivery. It is very important for us to know some of the risk factors to developing neonatal jaundice. Congenital abnormalities or infections and diseases are all implicated in neonatal jaundice. For instance, if your baby has a congenital abnormality affecting the liver, mainly the Crigler-Najjar and Gilbert syndrome, the chances of developing neonatal jaundice is very high. This hereditary conditions, the Crigler-Najjar and the Gilbert syndrome, are hereditary conditions that affects the liver's ability to get rid of bilirubin from the system. GCSP deficiency. I have a video talking about GCSP deficiency. If by now you've not watched my video and you don't even know the status of your baby, it's very, very bad. Make sure you watch my video to know all about GCSP deficiency. Babies who have been diagnosed with GCSP deficiency have a higher risk of developing neonatal jaundice as well. Trauma during birth injuries are also implicated in developing neonatal jaundice. Maternal medical conditions like diabetes have also been implicated as a risk factor to developing neonatal jaundice. If you do not feed your baby well, or poor feeding or breast milk feeding of the baby have also been implicated as a major risk factor to developing neonatal jaundice. Mothers who are fond of taking herbal preparations. Mothers, when they are pregnant, you crave for a lot of things, but do not let herbal preparations be one of the cravings if you do not want to give birth to babies who are jaundiced. Babies who are born bigger than the average gestational age, what we call macrosomic babies, also have a higher risk of developing neonatal jaundice. Babies or preterm babies are also implicated in developing neonatal jaundice. So these are some of the risk factors we need to know. Medical conditions or hereditary conditions that affect the liver, trauma during birth injuries, GCSPD deficiency, rhesus factor incompatibility, the mother who has diabetes, babies who are born bigger than the average gestational age, babies who are born or preterm delivery or preterm babies. All these are known risk factors to developing gestational or neonatal jaundice. It is very important. What I'm going to say, the next part of this video is very important, which I'm going to talk about is the signs and symptoms of neonatal jaundice. The management of neonatal jaundice will be successful and will only be managed properly when the signs and symptoms are detected very early. So the management of neonatal jaundice is based on the early detection of the signs and symptoms. What are some of the signs and symptoms? It includes the pale or the yellowish coloration of the skin and the sclera. So you see your baby's eyes are very yellow, the skin is also very yellow. The stools of the babies or the neonates are also very pale. In severe cases, or what we call bilirubin-induced neurologic dysfunction, where the bilirubin has moved or been deposited in the brain, you will notice that the baby has high-pitched cry. The baby is crying on top of their voices. The sound is very, very, very high than normal. The baby starts developing seizures. The tone of the skin changes. It either becomes rigid or becomes flaccid, very, very soft. These are some of the signs you need to take note of. So let me go over the signs and symptoms again. The yellowish coloration of the skin and the eyes, paleness of the stool. In severe cases, the baby begins to cry or has high-pitched sounds of cry, seizures or convulsions. The skin tone begins to change, either becomes too rigid or too flaccid. Let's look at some of the ways we can prevent neonatal jaundice. Before I come to that, there are two main modalities of management of neonatal jaundice, which depends on the early detection. As I said earlier on, very, very important, early detection of the signs and symptoms. The modalities are exchange transfusion, where a donor's blood, which does not have bilirubin, is infused in the baby to get rid of the blood that has bilirubin. And then we have the phototherapy, where the baby is placed under certain types of wavelengths of light to make sure the unconjugated bilirubin is broken down into water-soluble forms to be excreted from the baby system. The preventive ways include: one, if you, the mother, you have a history of giving birth to babies or neonates who have been diagnosed of or who have neonatal jaundice, it is very important that you seek early medical attention. Seek early medical attention. Make sure as a mother, you do not take over-the-counter medications, you do not take herbal preparations, and make sure you attend regular A&C antenatal. Make sure you attend regular A&C. And make sure you give birth at a certified medical hospital. If you give birth at home, these traditional birth attendants, they do not know neonatal jaundice. They will probably be thinking the baby has a very nice skin, the skin is yellow and all those things, which is very, very wrong. So make sure you adhere to some of these preventive ways that I've mentioned. You give birth at a certified medical facility. You make sure you avoid taking herbal preparations and over-the-counter medications. You be on the lookout of some of these things. It is very, very important that if your baby has neonatal jaundice, you do not, and I repeat, you do not put breast milk in their eyes. I mean, I've noticed some of these things while I was young and even growing up, and even till date. Some of the moms, they become so worried and anxious, and they end up putting breast milk. It doesn't help. Putting breast milk in the eyes of the baby will not help clear the jaundice. And you take the baby to the hospital as soon as possible, and the doctors and the midwives and the nurses around will take care of the rest for you. Make sure you avoid putting camphor with the baby's clothes. Do not do that. Do not do that. Avoid putting camphor or adding camphor to the baby's clothes. And do not give supplementary glucose to the baby. What are you doing? Do not do all of these things. Some of the complications include the baby developing seizures or convulsions later in life. And you realize if neonatal jaundice is not detected earlier, the baby cannot perform basic functions such as speech, hearing, will have hearing difficulties, speech impediment, cannot even walk properly. So it is very important that we know neonatal jaundice because the complications are there, very serious, and they are irreversible if it is not detected earlier. So these are some of the things I want us to learn about neonatal jaundice. A very quick recap. The signs and symptoms: yellowish coloration of the skin and the eye. The stool becomes pale. In severe cases, the sound or the baby begins to cry in a high-pitched sounds. Baby develops seizures or having seizures and all those things. The skin of the baby begins to change. Either becomes too rigid or too flaccid. I hope you have learned something today about neonatal jaundice. Till I come your way the next time, I hope you have been educated. Subscribe to my YouTube channel. Thank you.